My name is Kelly McKenzie. I have a PhD in clinical psychology. As the behavioral health specialist, I work with residents on issues related to well-being. I also work with them on their behavioral health curriculum. Resident well-being, I think, is central to everything, right? Because we are expecting them to do a lot and learn a lot and accomplish a lot of things in 3 years. And if they aren't coming into it feeling the best that they can and taking good care of themselves, we can't expect them to take care of anybody else. Our goal is to make sure that they feel ready and empowered to be the best clinicians that they can be, both from how they are walking into the room and working with patients and their knowledge base and skills base. So we try to make sure that they have the well-being skills to take care of themselves, as well as the behavioral health skills to communicate effectively with patients and their families.
Our program has a really big emphasis on well-being. We learn about it through lectures, and we learn about it every day, seeing how our attendings spend their time and how they establish well-being for themselves in their practice. We also have a large portion where we're given time to ourselves, time to spend with family, but also time to spend with each other. Not as colleagues, but as friends. It's a whole characteristic of our residency to have well-being as a part of it.
A lot of times I often neglect taking care of myself, but this residency here has a big focus on that. Even down to our curriculums, everything is well planned where we're not burned out. I'm not stressed. I can't say I'm stressed, at least not at work. So it's a nice balance, and I think it's strategically done by our program coordinator, who's amazing. It's well planned so that it creates a nice learning environment, in my opinion, also.
Our program structure is set up in a very specific way to support resident well-being. We have things like quarterly retreats built in throughout the year. We also have monthly well-being time that's dedicated to different activities that are sometimes social in nature, but also, sometimes just things that we want to celebrate for them or teach them, those kinds of things. In our retreats, we try to focus on team cooperation and skills building and stuff like that, but again, also always that focus on well-being. Other things that we have built into our curriculum are like one-on-one support with me. So anytime a resident is struggling, they can contact me and I can reach out. It's confidential, and they're able to just chat with me about whatever it is that they're going through, and I can either help them with it in the moment or triage that in the right direction. We have support groups that we're going to be starting soon, as well as Ballant groups, which are basically a different type of debriefing when you've had a difficult case. And again, we consider those as important as any other aspect of our curriculum.
They positively reinforce integrating work and life, because that's what makes us, right? It's not just work then life, it's like work and life together. So yes, they really do create a positive environment for that.
It is relatively rare to have a behavioral health specialist. I know there have only been a couple of programs that I've worked with before who have had a dedicated person in this role. I think my role in our clinic is probably pretty unique in that I'm seeing my own patients alongside our residents, and they can pull me in if they're having an issue with a patient or even if they're just having a hard day. I think our ability to be creative and innovative has been a really cool thing. We care about them as people, and that may be unique. I hope it's not. I hope a lot of programs really care about their people, but I'm really proud of how much we emphasize it.